Question 1. An HHA is caring for a client with dementia who becomes agitated every evening. What is the most appropriate initial action for the HHA to take? A. Restrain the client to prevent injury. B. Administer a sedative medication. C. Try to identify the cause of the agitation and offer comfort. D. Leave the client alone to calm down. Answer: C. Try to identify the cause of the agitation and offer comfort. This question tests your understanding of how to approach client behavior changes, especially in clients with dementia, and the importance of person-centered care. The keyword "most appropriate initial action" indicates you need to prioritize non-invasive, investigative steps first. Agitation often stems from an unmet need or environmental trigger, so identifying the cause, like pain, hunger, or overstimulation, and then offering gentle reassurance or a distraction is the correct first step. For instance, if the client is hungry, offering a snack might resolve the agitation, demonstrating that understanding the root cause is key. Always remember to look for the why behind a client's behavior before resorting to more restrictive actions. Question 2. A client has been prescribed a new medication that is outside the HHA's scope of practice to administer. What should the HHA do? A. Administer the medication as directed to help the client. B. Inform the client that they cannot administer the medication and notify the supervisor immediately. C. Ask a family member to administer the medication instead. D. Read the instructions carefully and give the medication if it seems simple. Answer: B. Inform the client that they cannot administer the medication and notify the supervisor immediately. This question addresses the critical concept of the HHA's scope of practice and professional boundaries. The keywords outside the HHA's scope of practice are a clear indicator that the HHA must not perform the task. An HHA's primary responsibility is client safety, and performing tasks outside their training or legal limits can endanger the client and lead to serious consequences for the HHA. For example, an HHA cannot give injections or change sterile dressings, so reporting this to the supervisor ensures the client receives proper care from a qualified professional. Always know your limitations and communicate them promptly to ensure client well-being and maintain professional integrity. Question 3. When assisting a client with ambulation using a gait belt, where should the HHA position themselves? A. Directly in front of the client to guide them. B. Slightly behind and to one side of the client, holding the gait belt firmly. C. A few feet away to observe their balance. D. On the client's stronger side, supporting their arm. Answer: B. Slightly behind and to one side of the client, holding the gait belt firmly. This question assesses proper body mechanics and safety protocols during client transfers and ambulation. The key phrase "assisting a client with ambulation using a gait belt" points to the HHA's role in providing support and preventing falls. Positioning yourself slightly behind and to the side, maintaining a firm grip on the gait belt, allows the HHA to quickly respond if the client loses balance, ensuring safety without impeding their movement. For instance, if the client stumbles, you can gently pull them back toward you using the gait belt to regain balance. Remember, your position should offer immediate support and control to prevent falls. Question 4. A client reports feeling very dizzy and lightheaded after standing up quickly. What is the HHA's immediate priority? A. Offer the client a glass of water. B. Help the client sit or lie down to prevent a fall. C. Take the client's blood pressure immediately. D. Encourage the client to walk slowly to improve circulation. Answer: B. Help the client sit or lie down to prevent a fall. This question focuses on recognizing and responding to immediate safety risks, particularly falls, which are a common concern for home health clients. The keywords very dizzy and lightheaded after standing up quickly strongly suggest orthostatic hypotension or a similar condition that increases fall risk. The immediate priority is always client safety, so helping them sit or lie down prevents potential injury from a fall, which is more urgent than taking vitals or offering water. For example, if a client experiences dizziness, gently guiding them back into their chair or onto the bed can prevent a dangerous fall. Prioritize fall prevention by ensuring the client is in a safe, stable position first. Question 5. Which of the following is the most effective way for an HHA to prevent the spread of infection? A. Wearing gloves for all client interactions. B. Washing hands thoroughly with soap and water or using an alcohol-based sanitizer. C. Keeping the client's environment completely sterile. D. Disinfecting all surfaces once a week. Answer: B. Washing hands thoroughly with soap and water or using an alcohol-based sanitizer. This question tests your knowledge of the fundamental principles of infection control, a core responsibility for all HHAs. The keyword most effective way directs you to the single most impactful action. Hand hygiene, through proper washing with soap and water or using an alcohol-based sanitizer, is universally recognized as the single most important measure to prevent the spread of germs and infection. While gloves and environmental disinfection are important, they are secondary to consistent and correct hand hygiene. For instance, washing your hands before and after providing personal care protects both you and the client from germs. Always remember that clean hands are your best defense against infection. Question 6. The HHA notices a new red, non-blanchable area on a client's sacrum during bathing. What should the HHA do next? A. Rub the area vigorously to improve circulation. B. Apply a warm compress to the area. C. Document the finding and report it to the supervisor immediately. D. Cover the area with a standard bandage. Answer: C. Document the finding and report it to the supervisor immediately. This question assesses your ability to identify and respond appropriately to signs of potential skin breakdown, a critical aspect of client care. The keywords new red, non-blanchable area on a client's sacrum are crucial, describing a common early sign of a pressure injury, also known as a bed sore. An HHA should never rub or apply home remedies to such an area. Instead, their role is to observe, document accurately, and report changes to the nursing supervisor so a proper assessment and treatment plan can be initiated. For example, documenting the size, location, and appearance of the area allows the nurse to track its progression and intervene quickly. Prompt reporting is essential because early detection of skin changes can prevent more severe complications. Question 7. A client with diabetes has a small cut on their foot. Why is it particularly important for the HHA to report this immediately to the supervisor? A. The HHA is not allowed to touch a client's feet. B. Cuts on the feet of diabetic clients can lead to serious infections and complications. C. It indicates the client is not caring for themselves properly. D. The client might need special shoes. Answer: B. Cuts on the feet of diabetic clients can lead to serious infections and complications. This question tests your understanding of specific health risks associated with diabetes, particularly regarding foot care. The keywords client with diabetes and small cut on their foot are critical clues. Individuals with diabetes often have reduced sensation, neuropathy, and poor circulation, making them highly susceptible to slow-healing wounds and severe infections, which can even lead to amputation if not managed promptly. It is crucial for the HHA to report any skin break on the feet to ensure a nurse or doctor can assess and treat it quickly. For example, a minor cut that might heal easily for others can become a serious, limb-threatening infection for someone with diabetes. Always remember that foot care is paramount for clients with diabetes due to these unique risks. Question 8. What is the primary purpose of hospice care? A. To cure terminal illnesses. B. To provide aggressive life-sustaining treatments. C. To provide comfort and support for clients with terminal illnesses and their families. D. To help clients regain independence after an injury. Answer: C. To provide comfort and support for clients with terminal illnesses and their families. This question explores the fundamental concept of hospice care, which is distinct from curative or rehabilitative care. The primary purpose of hospice care is clearly indicated by the keyword hospice care, which focuses on quality of life rather than extending life when a client has a terminal illness. Hospice aims to manage pain and other symptoms, offering emotional and spiritual support to both the client and their family during the end-of-life journey. For instance, instead of focusing on chemotherapy, hospice care might ensure a client is comfortable, free from pain, and able to spend quality time with loved ones. Remember that hospice care is about comfort, dignity, and support during the final stages of life. Question 9. An HHA is assigned to a client who speaks a different language. What is the best way to ensure effective communication? A. Use hand gestures and speak loudly. B. Rely on family members to translate at all times. C. Use simple words, short sentences, and a professional interpreter if available. D. Avoid speaking much to prevent misunderstandings. Answer: C. Use simple words, short sentences, and a professional interpreter if available. This question addresses the crucial skill of effective communication, especially when language barriers are present, and highlights the importance of professional assistance. The keyword best way to ensure effective communication guides you to the most reliable and respectful method. While gestures can help, combining simple, clear language with the use of a professional interpreter, when possible, ensures accurate information exchange and respects the client's privacy and dignity. For example, if a client needs to explain their pain level, a professional interpreter can accurately convey their symptoms, which is vital for proper care. Always prioritize clear, accurate communication and use professional resources when a language barrier exists. Question 10. A client with osteoporosis is at high risk for fractures. Which action is most important for the HHA to take to ensure their safety? A. Encourage vigorous exercise to strengthen bones. B. Provide a diet rich in calcium. C. Implement fall prevention strategies in the home environment. D. Help the client wear tight-fitting clothing. Answer: C. Implement fall prevention strategies in the home environment. This question focuses on practical safety measures for clients with specific medical conditions, particularly those at risk for injury. The keywords client with osteoporosis and high risk for fractures indicate that preventing falls is paramount, as even a minor fall can lead to severe bone breaks. While diet and exercise are important for bone health, directly preventing falls through measures like removing clutter, ensuring adequate lighting, and using assistive devices is the most immediate and critical safety intervention for fracture prevention. For instance, ensuring rugs are secured or removed helps eliminate tripping hazards. Always prioritize fall prevention to protect clients with fragile bones. Question 11. The HHA observes that a client has not had a bowel movement in 3 days and is complaining of abdominal discomfort. What should the HHA do? A. Give the client an over-the-counter laxative. B. Tell the client to drink more water and wait another day. C. Document the observation and report it to the supervisor. D. Encourage the client to eat more fiber-rich foods immediately. Answer: C. Document the observation and report it to the supervisor. This question tests your ability to recognize changes in a client's condition and the appropriate reporting procedures for an HHA. The keywords "not had a bowel movement in 3 days" and abdominal discomfort are signs of potential constipation, which can become serious if not addressed by a healthcare professional. An HHA's role is to observe and report, not to diagnose or recommend medications or treatments. Reporting this to the supervisor ensures that a nurse can assess the situation and implement a proper plan of care. For example, the nurse might recommend a specific dietary change or a prescribed medication. Remember, your observations are crucial, but medical decisions are made by licensed professionals. Question 12. When assisting a client with personal hygiene, such as bathing, what is the most important principle for the HHA to remember? A. Complete the task as quickly as possible. B. Ensure the client's privacy and dignity are maintained. C. Use very hot water to kill germs. D. Bathe the client only once a week. Answer: B. Ensure the client's privacy and dignity are maintained. This question emphasizes a fundamental ethical principle in caregiving, respecting the client's dignity and privacy during intimate tasks. The keyword "most important principle" directs you to the core value that guides all personal care. While efficiency and hygiene are important, protecting a client's privacy by closing doors, covering them appropriately, and maintaining a respectful demeanor builds trust and preserves their sense of self-worth. For example, ensuring a client is properly covered while being bathed, exposing only the area being washed, helps maintain their dignity. Always remember that treating clients with respect and preserving their privacy is paramount in all aspects of care. Question 13. A client begins to choke while eating. The HHA assesses that the client is conscious but cannot speak or cough. What is the immediate action the HHA should take? A. Offer the client a drink of water. B. Encourage the client to cough forcefully. C. Perform abdominal thrusts, Heimlich maneuver. D. Call 911 immediately before doing anything else. Answer: C. Perform abdominal thrusts, Heimlich maneuver. This question tests your knowledge of emergency procedures, specifically how to respond to a choking incident. The keywords "conscious but cannot speak or cough" are crucial indicators of a severe airway obstruction requiring immediate intervention. In this scenario, the client cannot clear the airway on their own, making abdominal thrusts, the Heimlich maneuver, the most effective and immediate action to dislodge the obstruction. For instance, if a piece of food is visibly blocking the airway, abdominal thrusts apply pressure to help expel it. While calling 911 is important, the HHA must first attempt to clear the airway. Remember, immediate action for choking can be life-saving. Question 14. What is the purpose of recording a client's intake and output, INO? A. To track the client's sleep patterns. B. To monitor fluid balance and kidney function. C. To determine the client's preferred food choices. D. To assess the client's mobility level. Answer: B. To monitor fluid balance and kidney function. This question assesses your understanding of basic physiological monitoring and documentation. The phrase intake and output, INO, refers to measuring all fluids a client consumes, intake, and all fluids they eliminate, output, such as urine. Tracking INO is vital for monitoring a client's fluid balance, which is important for conditions like heart failure or kidney disease, and can indicate dehydration or fluid overload. For example, if a client's intake is much higher than their output, it could signal fluid retention, which needs to be reported. Always remember that INO is a critical tool for assessing a client's hydration status and kidney health. Question 15. The HHA enters a client's home and notices an unfamiliar person present who claims to be a new family friend. What should the HHA do? A. Assume the person is legitimate and continue with care. B. Politely ask the person to leave the home. C. Verify the person's identity with the client, if appropriate, and then report the situation to the supervisor. D. Immediately call the police. Answer: C. Verify the person's identity with the client, if appropriate, and then report the situation to the supervisor. This question addresses client safety, professional boundaries, and communication in unfamiliar situations within the client's home. The keyword unfamiliar person means the HHA needs to exercise caution while respecting the client's living environment. The HHA should first discreetly try to confirm the person's relationship with the client, if the client is capable, and then immediately report the situation to their supervisor. This ensures client safety and allows the agency to address any potential security concerns or changes in the care plan appropriately. For example, if the client seems uncomfortable or confused by the visitor, reporting it ensures professional guidance. Always prioritize client safety and report anything unusual or concerning to your supervisor. Question 16. A client expresses a desire to refuse a bath today, stating they feel too tired. What is the HHA's appropriate response? A. Explain that the bath is part of the care plan and must be done. B. Gently encourage the client, explaining the benefits of hygiene, but respect their informed refusal. C. Report the client's non-compliance to the supervisor. D. Administer the bath quickly to get it over with. Answer: B. Gently encourage the client, explaining the benefits of hygiene, but respect their informed refusal. This question tests your understanding of client rights, specifically the right to refuse care, and how to balance it with providing appropriate support. The keyword refuse a bath highlights the client's autonomy. While hygiene is important, competent clients have the right to refuse care. Your role is to educate, encourage, and understand their reasons, but ultimately respect their decision. For example, you might offer to do a partial bath or reschedule for later, demonstrating flexibility and respect. Always prioritize client autonomy while gently encouraging care, and then document any refusals and inform your supervisor. Question 17. The HHA needs to reposition a heavy client in bed. What is the most important principle to follow? A. Pull the client quickly to minimize discomfort. B. Lift the client directly without assistance. C. Use proper body mechanics and ask for assistance if needed. D. Reposition the client only if they can help. Answer: C. Use proper body mechanics and ask for assistance if needed. This question emphasizes the critical importance of proper body mechanics and safety, both for the HHA and the client, during transfers and repositioning. The keywords reposition a heavy client highlight the significant risk of injury if not done correctly. Using proper body mechanics, such as bending your knees and keeping your back straight, along with seeking help from another person when the client is heavy, prevents musculoskeletal injuries to the HHA and ensures the client's safety. For instance, using a draw sheet with a coworker allows you to slide the client without straining your back. Always prioritize your safety and the client's by using proper techniques and getting help for heavy tasks. Question 18. What is the correct way to measure a client's oral temperature? A. Place the thermometer under the armpit. B. Place the thermometer in the rectum. C. Place the thermometer under the tongue and have the client close their lips. D. Hold the thermometer to the client's forehead. Answer: C. Place the thermometer under the tongue and have the client close their lips. This question assesses your basic clinical skills, specifically the correct procedure for taking vital signs. The keyword oral temperature specifies the method. For an oral temperature, the thermometer tip is placed under the client's tongue, and they are asked to close their lips around it to ensure an accurate reading. This method ensures the thermometer is in contact with the oral mucous membranes, which reflect core body temperature. For example, if a client has recently had a hot drink, you should wait 15 minutes before taking an oral temperature for accuracy. Always follow the correct procedure for each vital sign measurement to get reliable results. Question 19. A client is refusing to eat their meal, stating they are not hungry. What is the best first approach for the HHA? A. Remove the meal and offer it again later. B. Insist the client eat, explaining it's important for their health. C. Force feed the client small bites to ensure nutrition. D. Try to identify why the client is not eating and offer alternatives or smaller portions. Answer: D. Try to identify why the client is not eating and offer alternatives or smaller portions. This question addresses client-centered care and effective problem-solving when a client refuses food. The keywords refusing to eat and best first approach indicate you need to be empathetic and investigative rather than demanding. Clients may refuse food for many reasons, such as pain, nausea, dislike of the food, or difficulty chewing, so understanding the underlying cause is crucial. Offering alternatives, smaller portions, or making mealtime more comfortable respects their autonomy and increases the likelihood of them eating something. For instance, if the client dislikes a particular food, offering a simple substitute like toast might encourage them to eat. Always try to understand the client's reasons and offer flexible solutions to encourage nutrition. Question 20. When assisting a client with toileting, what is the most important infection control measure? A. Open the window for ventilation. B. Wear clean gloves and wash hands thoroughly afterwards. C. Use air freshener in the bathroom. D. Wipe down all surfaces with water. Answer: B. Wear clean gloves and wash hands thoroughly afterwards. This question focuses on applying infection control principles specifically during personal care tasks involving bodily fluids. The keywords assisting a client with toileting and most important infection control measure highlight the direct contact with potential pathogens. Wearing clean gloves creates a barrier to protect both the HHA and the client from germ transmission, and thoroughly washing hands afterwards removes any germs that may have come into contact with skin. For example, gloves prevent germs from feces or urine on the client's skin from transferring to the HHA's hands. Always remember that gloves are a barrier, but hand washing is the ultimate safeguard against infection after any task involving body fluids. Question 21. A client with a hearing impairment does not seem to understand the HHA's instructions. What should the HHA do to improve communication? A. Shout louder so the client can hear. B. Speak slowly and clearly, face the client, and use gestures if helpful. C. Give up and write down all instructions. D. Ask a family member to always translate. Answer: B. Speak slowly and clearly, face the client, and use gestures if helpful. This question addresses effective communication strategies, especially for clients with sensory impairments. The keyword hearing impairment indicates the need for specific adjustments to ensure the client understands. Speaking slowly and clearly, facing the client so they can read lips, and using appropriate gestures can significantly improve comprehension. Shouting can distort words and be disrespectful. For example, if explaining how to hold a cup, demonstrating the action while speaking slowly can be very effective. Always adapt your communication style to the client's needs to ensure they understand care instructions and feel respected. Question 22. What is the appropriate response if an HHA accidentally spills a client's urine specimen while taking it to the bathroom? A. Quickly wipe it up and pretend it didn't happen. B. Report the spill to the supervisor, clean the area with appropriate disinfectant, and collect a new specimen. C. Cover the spill with a towel and leave it for the next shift. D. Rinse the area with water and continue with duties. Answer: B. Report the spill to the supervisor, clean the area with appropriate disinfectant, and collect a new specimen. This question tests your knowledge of infection control, incident reporting, and accountability in a caregiving setting. The keyword accidentally spills a client's urine specimen points to a biohazard incident. The correct procedure involves immediately cleaning the area thoroughly with a proper disinfectant to prevent germ spread, documenting the incident as an accident, and reporting it to the supervisor to ensure appropriate follow-up, including collecting a new, uncontaminated sample. For instance, using a bleach solution to clean the spill ensures complete disinfection. Always report and properly clean spills of bodily fluids to maintain a safe and hygienic environment. Question 23. An HHA notices that a client's usually tidy room is now very messy with clothes and trash scattered around. What should the HHA consider first? A. The client is being lazy and uncooperative. B. The client might be experiencing a change in their health or cognitive status. C. The HHA needs to clean the room immediately without asking. D. The client is intentionally trying to make more work for the HHA. Answer: B. The client might be experiencing a change in their health or cognitive status. This question focuses on observational skills and recognizing subtle signs of changes in a client's condition, which is a key HHA responsibility. The keyword usually tidy room is now very messy indicates a significant change in the client's environment and routine. Such a change can often be a subtle indicator of a decline in physical ability, cognitive function, like dementia, or even depression. It's essential to consider underlying health changes before making assumptions about the client's intent. For example, a client struggling with memory might forget where things belong or lack the energy to tidy up due to a new illness. Always observe environmental changes as potential clues to a client's well-being and report them. Question 24. What should an HHA do if they discover a client's prescribed medication has expired? A. Administer the expired medication, as it's probably still effective. B. Discard the medication immediately to prevent accidental use. C. Report it to the supervisor and do not administer the medication. D. Ask the client to get a new prescription themselves. Answer: C. Report it to the supervisor and do not administer the medication. This question addresses medication safety and the HHA's role in reporting concerns, even though medication administration is usually outside their scope. The keyword expired medication immediately flags a safety issue. Administering expired medication is dangerous and against policy, as its effectiveness and safety cannot be guaranteed. The HHA should never discard medication or advise clients on prescriptions. Their responsibility is to identify the issue, not administer the medication, and report it to the supervisor to ensure the client receives proper, unexpired medication. For example, a nurse can contact the pharmacy or physician to arrange for a refill. Always prioritize client safety by never administering expired medication and promptly reporting it. Question 25. The HHA is preparing to transfer a client from the bed to a wheelchair. What should be done first to ensure safety? A. Lock the wheels of the bed and the wheelchair. B. Position the wheelchair directly facing the bed. C. Ask the client to stand up on their own. D. Quickly move the client to avoid wasting time. Answer: A. Lock the wheels of the bed and the wheelchair. This question tests your knowledge of essential safety procedures during client transfers. The keyword transfer a client from the bed to a wheelchair highlights a common task with significant fall risks. The very first and most critical step is to lock the wheels of both the bed and the wheelchair. This prevents either object from moving unexpectedly during the transfer, which could cause the client to fall and suffer injury. For instance, if the wheelchair wheels are not locked, it could roll away as the client attempts to sit down, leading to a fall. Always ensure all equipment is stable and secure before starting any client transfer. Question 26. When a client expresses feelings of sadness and hopelessness, what is the HHA's best response? A. Tell the client to cheer up and focus on positive things. B. Ignore the comments and change the subject. C. Listen actively, acknowledge their feelings, and report concerns to the supervisor. D. Offer medical advice or try to diagnose their condition. Answer: C. Listen actively, acknowledge their feelings, and report concerns to the supervisor. This question focuses on empathetic communication and appropriate reporting when a client exhibits signs of emotional distress. The keywords sadness and hopelessness suggest potential depression or other mental health concerns. The HHA's role is not to diagnose or provide therapy but to offer support by listening, validating their feelings, and then reporting these observations to the supervisor. This ensures that the client's emotional well-being is monitored and professional help can be considered. For example, saying, "It sounds like you're having a tough day, and I'm here to listen," shows empathy. Always listen with compassion and report changes in emotional state to your supervisor. Question 27. What is the primary reason for encouraging a client to perform as much self-care as possible? A. To reduce the HHA's workload. B. To promote the client's independence and self-esteem. C. To speed up the care process. D. To allow the HHA to complete other tasks. Answer: B. To promote the client's independence and self-esteem. This question addresses a core principle of client-centered care and rehabilitation. The phrase "encourage a client to perform as much self-care as possible" emphasizes supporting client autonomy. Allowing clients to participate in their own care, even small tasks, helps maintain their independence, dignity, and self-esteem, which are crucial for their overall well-being. For example, letting a client brush their own hair, even if it takes longer, empowers them to remain actively involved in their daily routine. Always prioritize fostering independence as it greatly benefits a client's physical and mental health. Question 28. An HHA finds a client confused and disoriented, which is a change from their usual mental state. What should the HHA do first? A. Assume it's normal aging and continue with care. B. Restrain the client to prevent them from wandering. C. Ensure the client's immediate safety and report the change to the supervisor immediately. D. Give the client a snack and observe them for an hour. Answer: C. Ensure the client's immediate safety and report the change to the supervisor immediately. This question tests your ability to recognize and respond to a significant, acute change in a client's cognitive status, which is a medical emergency. The keywords confused and disoriented, which is a change from their usual mental state, indicate an urgent need for assessment. The immediate priority is to ensure the client is safe from harm, e.g., falling or wandering, and then promptly report this critical change to the supervisor so that the nurse can assess for causes like infection, medication side effects, or a stroke. For example, gently guiding a confused client to sit down might prevent a fall. Always prioritize safety and report acute changes in mental status without delay. Question 29. How often should an HHA check a client's care plan? A. Only when a new task is assigned. B. Once a month during a supervisor visit. C. At the beginning of each shift and whenever there are questions or changes. D. Never, as it is the supervisor's responsibility. Answer: C. At the beginning of each shift and whenever there are questions or changes. This question highlights the importance of the care plan as the guiding document for client care. The care plan outlines all specific tasks, client preferences, and safety precautions, ensuring consistent and appropriate care. Reviewing it at the start of each shift confirms the HHA is aware of current instructions, and checking it whenever questions arise or changes occur ensures the HHA follows the most up-to-date plan. For example, if a client's diet has been modified, checking the care plan will ensure you serve the correct food. Always refer to the care plan as your roadmap for providing safe and effective care. Question 30. A client's family member insists that the HHA perform a task that is not on the care plan and is outside the HHA's scope of practice. What should the HHA do? A. Perform the task to keep the family happy. B. Explain politely that the task is outside their scope of practice and refer the family to the supervisor. C. Tell the family member that the HHA is too busy. D. Do the task but don't tell the supervisor. Answer: B. Explain politely that the task is outside their scope of practice and refer the family to the supervisor. This question tests your professional boundaries, adherence to the care plan, and communication skills when faced with requests outside your role. The keywords "not on the care plan" and "outside the HHA's scope of practice" are critical indicators that the task cannot be performed. The HHA must politely decline, explaining the limitations of their role, and then immediately inform the supervisor. This allows the supervisor to address the family's request appropriately, ensuring the client receives safe and authorized care. For example, if asked to give an injection, you must politely decline and explain that only a nurse can perform that task. Always protect yourself and the client by adhering strictly to your scope of practice and reporting concerns to your supervisor. Question 31. What is the best way to prevent falls in a client's bathroom? A. Keep the bathroom door locked. B. Ensure adequate lighting, use non-slip mats, and install grab bars. C. Encourage the client to avoid using the bathroom frequently. D. Always leave water on the floor to keep it clean. Answer: B. Ensure adequate lighting, use non-slip mats, and install grab bars. This question focuses on environmental safety and fall prevention strategies in a high-risk area for clients. The keyword "prevent falls in a client's bathroom" directs you to practical, effective modifications. Bathrooms are notoriously slippery and pose significant fall hazards. Adequate lighting helps clients see obstacles, non-slip mats reduce slippery surfaces, and grab bars provide stable support for transfers, all drastically reducing fall risk. For example, making sure there's a night light in the bathroom can prevent a fall during nighttime trips. Always prioritize a safe environment, especially in areas like the bathroom, to protect your clients. Question 32. What is objective data that an HHA might observe and document? A. The client states they feel pain. B. The client says they are happy. C. The client's skin is red and warm to the touch. D. The client reports feeling lonely. Answer: C. The client's skin is red and warm to the touch. This question distinguishes between objective and subjective data, a crucial concept in accurate observation and documentation. Objective data consists of factual information that can be observed, measured, or seen by others, while subjective data is what the client reports, their feelings or symptoms. Red and warm to the touch is something you can directly observe and feel, making it objective. For example, a rash is objective, while a complaint of itching is subjective. Always focus on observable facts when documenting objective data to provide clear, verifiable information for the care team. Question 33. Which action by an HHA demonstrates respect for a client's personal space and belongings? A. Rearranging the client's furniture without asking. B. Going through the client's drawers to organize them. C. Knocking on the client's bedroom door before entering. D. Using the client's personal phone to make a call. Answer: C. Knocking on the client's bedroom door before entering. This question addresses respectful client interaction and maintaining professional boundaries within the client's home. The keyword demonstrates respect for a client's personal space and belongings, guides you to an action that upholds dignity and privacy. Knocking before entering a client's private space, like their bedroom, is a fundamental sign of respect, just as you would for anyone in their home. It acknowledges their autonomy and privacy. For example, just as you expect privacy in your own home, clients deserve the same consideration. Always remember to treat a client's home as their private space and show courtesy and respect for their boundaries. Question 34. A client who uses a walker suddenly becomes weak and begins to fall forward. What is the HHA's immediate action? A. Try to lift the client back up quickly. B. Attempt to support the client and guide them gently to the floor. C. Run to get help from another person. D. Tell the client to hold onto the walker tightly. Answer: B. Attempt to support the client and guide them gently to the floor. This question tests your emergency response skills specifically related to preventing injury during an unexpected fall. The keywords "suddenly becomes weak" and "begins to fall forward" indicate an ongoing fall. The immediate and safest action is not to try and stop the fall completely, which could injure both you and the client, but to support the client as best as you can and guide them gently to the floor. This minimizes the impact and reduces the risk of serious injury. For example, you might use a gait belt to help control the descent to the floor. Always prioritize minimizing injury during a fall by controlling the descent rather than trying to prevent it entirely. Question 35. What is the primary purpose of a no resuscitation (DNR) order? A. To ensure the client receives all possible life-sustaining treatments. B. To allow family members to make all medical decisions for the client. C. To request that no extraordinary measures be taken to restart the heart or breathing if it stops. D. To discharge the client from home health care. Answer: C. To request that no extraordinary measures be taken to restart the heart or breathing if it stops. This question introduces the important ethical and legal concept of a do not resuscitate (DNR) order, which respects a client's end-of-life wishes. The phrase no resuscitation (DNR) order means the client has legally chosen not to receive cardiopulmonary resuscitation (CPR) or other life-sustaining measures if their heart or breathing stops. This decision is made by the client or their legal representative and is documented to ensure their wishes are honored, focusing on comfort rather than prolonging life. For example, if a client with a DNR stops breathing, the HHA would not perform CPR but would provide comfort and notify the supervisor. Always respect a client's DNR order as it reflects their right to choose their end-of-life care. Question 36. An HHA is providing care for a client with vision impairment. How can the HHA best orient the client to their surroundings? A. Rearrange furniture frequently to stimulate their senses. B. Describe the location of items and furniture clearly and consistently. C. Speak loudly so they can hear directions better. D. Assume they already know their home layout. Answer: B. Describe the location of items and furniture clearly and consistently. This question addresses specific care strategies for clients with sensory impairments, focusing on enhancing their safety and independence. The keyword vision impairment indicates the need for verbal and consistent guidance. Clearly describing the layout of the room, the location of items, and maintaining consistency helps the client build a mental map of their environment, reducing anxiety and preventing falls. For example, you might say, "Your water glass is on the nightstand to your right," and ensure it's always placed there. Always provide clear, consistent verbal cues and keep the environment stable to help clients with vision impairment navigate safely. Question 37. What is considered a violation of client confidentiality? A. Discussing the client's care plan with their primary nurse. B. Sharing details about the client's diagnosis with a neighbor. C. Documenting client observations in their care record. D. Talking to the client's authorized family member about their condition. Answer B. Sharing details about the client's diagnosis with a neighbor. This question tests your understanding of client confidentiality, a fundamental ethical and legal obligation for all healthcare providers. The keyword violation of client confidentiality points to an inappropriate disclosure of private information. Discussing a client's personal health information, such as their diagnosis, with anyone not directly involved in their care and without their consent, like a neighbor, is a serious breach of privacy and a legal violation. For example, never discuss a client's health issues or personal life in public or with unauthorized individuals. Always remember to protect your client's privacy by keeping all personal and medical information strictly confidential. Question 38. Why is it important for an HHA to encourage regular position changes for a bedridden client? A. To make the bed look neater. B. To prevent the client from becoming too comfortable. C. To prevent pressure injuries, bed sores, and improve circulation. D. To increase the HHA's workload. Answer C. To prevent pressure injuries, bed sores, and improve circulation. This question focuses on a critical aspect of care for immobile clients, preventing skin breakdown. The keywords regular position changes and bedridden client highlight the direct link to preventing pressure injuries. When a client remains in one position for too long, pressure on certain areas restricts blood flow, leading to skin damage. Regular repositioning redistributes pressure and improves circulation, which is essential for skin integrity and overall comfort. For example, turning a client every 2 hours relieves pressure on bony prominences like the hips and sacrum. Always prioritize regular repositioning to protect your client's skin and prevent painful bed sores. Question 39. An HHA is about to assist a client with eating. What is the most important step to take before offering the meal? A. Arrange the food attractively on the plate. B. Make sure the client is in an upright position. C. Tell the client what foods are being served. D. Get a full glass of water ready. Answer B. Make sure the client is in an upright position. This question addresses a critical safety measure during mealtime, particularly for clients who need assistance with eating. The keyword most important step points to the highest priority for preventing a serious complication. Placing the client in an upright position, e.g., sitting up in bed or in a chair, significantly reduces the risk of aspiration, which is when food or liquid accidentally enters the lungs instead of the stomach. For example, eating while lying down dramatically increases the risk of choking or developing pneumonia. Always ensure your client is in a safe, upright position before starting to eat to prevent aspiration. Question 40. A client with diabetes reports feeling shaky, dizzy, and suddenly very hungry. What might these symptoms indicate, and what should the HHA do immediately? A. High blood sugar. Offer a sugar-free drink. B. Low blood sugar, hypoglycemia, offer a quick-acting sugar source. C. Dehydration, give a large glass of water. D. Normal aging, continue with planned activities. Answer B. Low blood sugar, hypoglycemia, offer a quick-acting sugar source. This question tests your ability to recognize and respond to a common and potentially dangerous medical emergency for diabetic clients. The keywords shaky, dizzy, and suddenly very hungry are classic signs of low blood sugar or hypoglycemia. This condition needs immediate treatment because brain cells require a constant supply of sugar. Offering a quick-acting sugar, like juice, candy, or glucose tablets, helps raise blood sugar levels rapidly. For example, giving a client half a cup of orange juice can quickly alleviate these symptoms. Always recognize the signs of low blood sugar and act quickly to provide a simple sugar, then report to your supervisor. Question 41. The HHA notices a new bruise on a client's arm that cannot be explained by any recent activity. What is the appropriate response? A. Ignore it, as bruises are common in older adults. B. Confront the client's family about potential abuse. C. Document the observation accurately and report it to the supervisor. D. Apply a cold compress and observe for a few days. Answer: C. Document the observation accurately and report it to the supervisor. This question addresses the HHA's crucial role in identifying and reporting potential signs of abuse or neglect, which is a serious ethical and legal responsibility. The keywords "new bruise," "cannot be explained" are red flags indicating a need for further investigation by professionals. The HHA's role is to objectively document what is observed, size, color, location, and report it immediately to the supervisor, who will follow agency protocols for suspected abuse. For example, noting the exact location and size of the bruise provides important factual information for the report. Always remember that reporting suspicious or unexplained injuries is mandatory to protect vulnerable clients. Question 42. When assisting a client with dressing, what is the best approach for an HHA? A. Dress the client completely to save time. B. Choose clothes that are comfortable and easy for the client to put on. C. Let the client struggle to dress themselves to encourage independence. D. Dress the client in the clothes the HHA prefers. Answer: B. Choose clothes that are comfortable and easy for the client to put on. This question focuses on client-centered care and promoting independence during a routine task. The keyword "best approach" guides you to consider what optimizes the client's comfort and ability. Selecting clothing that is comfortable, loose-fitting, and easy to manage, e.g., with elastic waistbands or large buttons, makes the dressing process less frustrating and encourages the client to participate as much as possible. For instance, choosing front-opening shirts over pullovers can be much easier for a client with limited arm movement. Always prioritize clothing that enhances a client's comfort, dignity, and ability to participate in their own care. Question 43. What is the main reason for an HHA to wear gloves when handling soiled linens? A. To protect the linens from getting dirtier. B. To prevent the spread of microorganisms and protect the HHA from contamination. C. To keep the HHA's hands warm. D. To avoid touching the client's personal belongings. Answer: B. To prevent the spread of microorganisms and protect the HHA from contamination. This question assesses your understanding of standard precautions and infection control specifically related to handling potentially contaminated materials. The keywords "handling soiled linens" indicate a risk of exposure to bodily fluids and germs. Wearing gloves creates a protective barrier, preventing microorganisms from the linens from transferring to the HHA's hands and subsequently spreading to other surfaces or individuals. For example, gloves prevent skin contact with urine, feces, or blood that might be on the linens. Always wear gloves when handling soiled items to protect yourself and prevent the spread of infection. Question 44. A client frequently forgets their short-term memory, often asking the same questions repeatedly. How should the HHA respond? A. Remind the client firmly that they just asked that question. B. Answer the question patiently each time it is asked. C. Ignore the client's questions if they are repetitive. D. Tell the client to write down the answer. Answer: B. Answer the question patiently each time it is asked. This question addresses effective communication and empathetic care for clients with cognitive impairments, particularly short-term memory loss. The keywords "frequently forgets," Asking the same questions repeatedly are common behaviors in clients with dementia or other memory issues. The most therapeutic response is to answer patiently and calmly each time, rather than showing frustration or reminding them they just asked. This approach maintains the client's dignity, reduces their anxiety, and avoids agitation. For example, if a client repeatedly asks about lunch, calmly stating lunch will be ready in 15 minutes each time is the best approach. Always respond with patience and reassurance when a client with memory loss asks repetitive questions. Question 45. Before giving a client a bath in the tub, what is the most important safety check the HHA should perform? A. Ensure the water is as hot as possible. B. Check the water temperature to prevent burns. C. Fill the tub completely to the brim. D. Leave the client alone to test the water. Answer: B. Check the water temperature to prevent burns. This question emphasizes a critical safety measure when providing personal care involving water. The keyword "most important safety check" highlights the primary concern. Scalding from excessively hot water is a severe risk, especially for clients with decreased sensation or mobility. Always test the water temperature with a thermometer or your inner wrist to ensure it is comfortably warm, typically between 105 to 115 degrees Fahrenheit, 40.6 to 46.1 degrees Celsius, before the client enters the tub. For example, if the water feels too hot for your wrist, it is definitely too hot for the client. Always verify water temperature to prevent painful and dangerous burns. Question 46. What is the correct way to store a client's personal care items, like their toothbrush or comb? A. In a shared container with other clients' items for easy access. B. In a clean, labeled container or area designated for the individual client. C. On the edge of the sink where they are easily reachable. D. In the HHA's personal bag for safekeeping. Answer: B. In a clean, labeled container or area designated for the individual client. This question focuses on hygiene and infection control in relation to personal care items. The keyword "correct way to store" points to practices that prevent germ transmission. Each client's personal care items should be kept separate from others and stored in a clean, designated area to prevent cross-contamination and the spread of infection. For example, having a separate labeled cup for each client's toothbrush prevents germ exchange. Always ensure personal hygiene items are stored individually and hygienically to protect client health. Question 47. An HHA is assisting a client with feeding who suddenly starts coughing violently. What should the HHA do immediately? A. Encourage the client to continue eating. B. Help the client sit up further and encourage them to cough. C. Lie the client flat to make it easier to swallow. D. Leave the room to get help. Answer: B. Help the client sit up further and encourage them to cough. This question tests your immediate response to a potential choking or aspiration event during feeding. The phrase "suddenly starts coughing violently" indicates that the client may have food or liquid in their airway. The HHA's immediate action should be to help them sit more upright and encourage them to continue coughing, as coughing is the body's natural mechanism to clear the airway. For example, a slight lean forward can also assist the coughing effort. Always prioritize assisting the client to clear their own airway through coughing when they show signs of distress during feeding. Question 48. What information should an HHA include in an incident report? A. Opinions and assumptions about what happened. B. Only positive things about the HHA's actions. C. Factual, objective details of what happened, who was involved, and what actions were taken. D. Blame on who was at fault for the incident. Answer: C. Factual, objective details of what happened, who was involved, and what actions were taken. This question addresses accurate documentation and professional reporting of unexpected events. The keyword incident report indicates the need for a formal record. An incident report must always contain only factual, objective information about what occurred, including the time, date, specific observations, who was present, and the HHA's actions, without including personal opinions, assumptions, or blame. For example, instead of writing, "The client was careless and fell," write, "Client lost balance and fell to the floor at 10:30 a.m. Always strive for objective, factual reporting to ensure clarity and accuracy for investigations and follow-up. Question 49. What is the purpose of rotating a client's personal protective equipment, PPE, like masks and gowns? A. PPE should never be reused or rotated, it is single-use. B. To save money by making PPE last longer. C. To allow different HHAs to use the same PPE. D. To test if the PPE is still effective. Answer: A. PPE should never be reused or rotated, it is single-use. This question addresses a critical principle of infection control regarding the proper use of personal protective equipment, PPE. The keywords rotating a client's PPE indicate a misconception. Most PPE, such as masks and gowns, is designed for single use only and must be discarded after one client encounter or when visibly soiled. Reusing or rotating PPE greatly increases the risk of cross-contamination and the spread of infection to both the HHA and other clients. For example, a used gown carries germs, and reusing it would transfer those germs. Always remember that PPE is single-use and must be properly discarded after each use to maintain a sterile barrier. Question 50. An HHA is caring for a client who is nearing the end of life. The client states, "I'm not afraid to die." How should the HHA respond? A. Change the subject to something more cheerful. B. Tell the client they shouldn't talk that way. C. Listen quietly and acknowledge their feelings with a supportive presence. D. Offer false reassurance by saying, "You'll be fine." Answer: C. Listen quietly and acknowledge their feelings with a supportive presence. This question tests your ability to provide empathetic and supportive care to clients at the end of life. The client's statement, "I'm not afraid to die," indicates they are processing profound emotions. The HHA's best response is to listen without judgment, offering a quiet, supportive presence and acknowledging their feelings. This validates the client's experience and creates a space for them to express themselves, rather than shutting down the conversation or offering unhelpful platitudes. For example, simply holding their hand or maintaining eye contact can show you are present and listening. Always provide a comforting and accepting presence when a client shares their end-of-life thoughts and feelings.